Yeah, I was mentioning I work at one Memorial Medical Center, and many of the patients are from Latin American countries. So when I visit patients and I speak in English, people ask me where I'm from because of my accent. But when I speak Spanish, people ask me where I'm from because of my accent. So I'm stuck with my accent. Okay, just before I start, how many of you are pastors or working okay, so 2. And how many are related with the mental health department? Okay.
I'm a chaplain.
You're a chaplain. Okay. So pastor chaplains. Okay.
Excuse me?
Yes.
You one for people that are consumers or people with lived experience?
Okay, so you are one of. Okay, so people who have no. Okay.
I'm a consumer.
You are a consumer. Okay. So we have. Okay. Thank you for reminding that. Probably is going to help us with the same.
Very important.
Very important. Okay. So let me. This is a handout. So please, get one of those and I'm doing an experiment with my iPad and with my phone, and hopefully will work. Okay. The background from our this presentation has to do probably, as have been mentioned, in the year 2010, the director of Los Angeles County Department of Mental Health initiated a new strategic plan, which is develop partnership with faith-based organizations to enhance opportunity for clients to utilize the spiritual choices in support of the recovery goals. So this is important, at least from the perspective of a pastor, of a chaplain, that our government organization wants to reach out to our faith community and then want to partner with us. And what I'm going to present today is an example of that partnership between a faith-based, because our institution is a faith-based institution facility, and the mental health department. And I think that this even could apply to a church. Okay? So think of that perspective, not only that it was done in the hospital, but that could be done in any church. Okay. So this seminar was offered by the Los Angeles County and then was hosted by the One Memorial Medical Center. And it was interesting that a year ago, in the last conference that we had with mental health, we were talking with Adrienne, and it came the idea that it would be nice if we present this, program spirituality in one of our hospitals, in one of the chaplains, another chaplain or pastors, so we can talk a little bit about this issue. And they thought that it would be nice if we do it for the Spanish population, and they choose White Memorial because White Memorial is located in it's LA, and then there are probably 90% or more of the patients of the population there are Spanish-speaking people. Okay, these are some basic statistics that that 1 in every 3 adults suffer from a mental health disorder in any given year. What is amazing is that probably the mental health personnel, they will go that, but what is amazing that sometimes from the pastoral perspective, we think, okay, that's a statistic, and that's probably something that is happening there, but it's not happening here in our church. Those percentage 1 in 3, 33%, probably something outside, but this probably won't happen in our church. But there's certain things. For instance, there was a survey done with 6,000 members of 24 churches representing 4 Protestant denominations, and then they were surveying about family stresses, strength, faith practice, and those things. And it's interesting that the results show mental illness in 27% of those families. So those are families who go to church, and then 6,000, and that's probably what some of the statistics, the facts show. So they say about 25. So in this particular study was 27. And then what was important here is that the families with mental illness score lower on the measure of family strength and faith practices. But this is important. The families that were affected, they were crying for help from the congregation. But the congregation was virtually, but they were ignored by the congregation. So it was kind of a tension. The family, crying, we need help from you guys, from the congregation. And the congregation basically ignored that claim. That's according to this study. One of the scientists who conducted this study, she finished that this Dr. Garland, she said, mental illness is not only prevalent in church community, but is accompanied by a significant distress that often goes unnoticed. Partnership between mental health providers and congregations may help to raise awareness in the church community and offer assistance to struggling families. So the conclusion for this study is that could be good if there's a partnership between the church communities and the mental health providers. Okay, and these some statistics that was presented, and then this could apply to any ethnicity. I mean, you could apply to the African Americans, you could apply to Korean, to whatever, because in every community there are, issues with mental health. So here, Latinos are identified with a high risk for depression, anxiety, and substance abuse. Women and Latinos are more likely to experience a major depressive episode. And what is interesting that the prevalence of depression, according to these health facts, is more prevalent in Latino women than Latino men. So I don't know why, but that's something that is there. And then another thing that I found, at least from my perspective, very interesting, that mental illness is more prevalent among the U.S. born here, American citizens, and those who have been living here for a long time. So, when you compare with those people who are just arriving to the United States, and that's at least for the Latino, for this study, so reflecting that we think the American dream probably is doing something for those Latinos. So
May I ask it?
Yes.
Is that the general population?
No, that's
Just
Latino.
The Latinos
That's
who were born
Latino.
here.
Latino were born. So the Latino who were born here, when you compare, the second generation or third generation of Latinos with the Latinos who just came here, and even with Latinos who have been here for a longer period of time, living here for, kind of more Americans than they, so they notice that it is more present. Okay? And then the other thing that is important is that Latinos, and then this is probably something that applies not only for the Latinos, but for the general population, that they try to seek treatment in other settings. In other words, instead of going to the specialist, they go to the clergy or they go to the physician or the person to try to get some kind of counseling for those things. And then for Latinos, 1 in 11 contact mental health specialists, but with the Latinos immigrants, those who just come in, is fewer than 1 in 20. So those facts are very interesting. So the generation, the second generation probably, even though have more problems, they try to look for more, help from the mental health, while those who are just arriving to this country, they could be legal probably, so they are not aware of the services that are available, or they are afraid to get some kind of help. Okay, so that's probably what happens there. Another concept that is very important, I perceive it from my perspective, is the context of spirituality. This morning, the key speaker, she talked a little bit about spirituality. And I think this is important because it would seem to me that there are two different languages. It's like sometimes when I speak Spanish, and then if you don't understand Spanish, you may be, I don't know where, cloud, because there's not that language, that communication. And I think sometimes happen the same thing when we talk about the spirituality between pastors and the clinicians. It's like we were talking two different languages. We say the same thing. I mean, we read the same thing, but we say totally different. And then this is according to the mental health definition of spirituality. And by the way, I think that to define spirituality is very difficult. We could describe what spirituality does, But defining spirituality is kind of difficult, if not impossible. We describe what it does, the effects of spirituality, but to basically, this is a little bit different. But anyhow, these are two approaches to try to define spirituality. One of them is say spirituality is a person's deepest sense of belonging and connection to a higher power. And basically, the definition that we are emphasizing is this one. Spirituality is a process of pursuing meaning and purpose in life. Okay? So it's something that meaning and purpose in life. A generic approach assumes that spirituality needs to be something that is applicable to all people in all cultures. Now, for pastors, probably we have a little bit difficult for us to try to understand this concept. Because this concept would mean that if I want to play golf, I could find playing golf as part of my spiritual process. Okay? Or if I want to jog, or if I want to kind of listen to some music, those kind of things, that's a way for me to find spirituality. Okay? So that would be that concept, general concept, and probably some of us will have some issues, trying to understand this generic approach. The other approach is the biological approach, assuming that spirituality is present in all human beings. Today, the speaker was talking about neurotheology. You got that, and then basically this is what is here. That we are wired for religious and spiritual experience, and then there's an area in our brain that is designed to receive religious and spiritual experience. So basically, that's the approach, and then probably the faith-based and the scientists, we could agree, there's something inside us. But the third approach is approach from religion, and sometimes people try to, separate and they say, well, spirituality is not religion, or religion is not spirituality. But there are people who approach spirituality from the point of view of what? Of religion. And it was presented again, the transcendent, God, high power, the sacred, like things, objects that we have, and religion as behavior, church attendance for people who are, and what religious people do. And then probably for us, we feel comfortable, the pastors, because this is something that we kind of, do it on a regular basis. So here what is important, I think, and this seminar helps us to understand from the perspective of the pastor, is that the spirituality is much more, the concept of spirituality is much more than the concept from, the approach from religion. It's much more than the religion as behavior, the relationship with God, which is important, and we should emphasize what the person said, but probably it's more than that. So that basically helps us to understand that language difference here, in the middle. Okay, and I just want to share this with you. This author says that there are three basic spiritual needs: to be loved and to love in return, to experience forgiveness and extend it to others, and to find meaning and purpose in life and hope for the future. So basic three spiritual needs. And I think that was very clear in the seminar that was presented in our facility. Yes?
What's your name again, sir?
Edgar, Chaplain Edgar.
Edgar?
Yes.
Pastor Edgar, for me, I have a bishop, and his name is Bishop Blake. And the thing about him is like, it was a lady, she was not all there.
Okay.
And then she had a mental illness, and what they did, they just turned her away.
Yes.
And and I understand when they, and that was not right, because she had a mental illness, and from my understanding, I began to understand that. My question is to you, doctor, is like, why do when people have mental illness and the church should get involved in that? Why they want to get involved to help the people that have mental illness?
That's a very good question. excellent question, and that's something that we're going to try to answer today.
Because that's when because they me think about it is they always like you were saying about people have mental illness and they try to seek their help because they need help. But
Okay.
there's big churches like mega churches like Creflo Dollar or Bishop Blake, whatever church. But like you said, the people have mental illness. Like they just look at them, they talk about them, and they talk to themselves. But then they don't even try to help them. They need the help. They try to get help, and they just look at them like they crazy. Like they be like, oh, I want to get next to that person, and that's wrong because the people that have mental illness, they need help. And then I'm beginning to understand what you're saying now because that they really need to find a solution about when people have mental illness. They should never turn nobody away. They
Yes.
have mental illness. So my question is too, what can we do about that?
That's what it's talking about.
Okay. That's one
sorry.
approach.
That's
What
okay.
we're doing,
That's
that's
okay.
fine. What we're doing, one of the things that we are doing is that the Department of Mental Health
Mm-hmm.
is going to the churches and then is trying to educate the pastors
Mm-hmm.
of how to treat, patients or people,
Mhm.
the congregants, the members of the church.
Mhm.
So they will be open and they will be available when situations like that come, so they can have love, okay?
Right.
And then they can have, try to help find the meaning purpose of it. And then after me, we're going to be talking something very practical that her church, and we're going to use that term, so
That's
that she will understand, what that church congregation is doing for a specific congregation, then probably it's going to be meaningful for you. Okay?
Thank you.
Okay, thank you. That was a good question. Okay, so with these things,
Another question.
yes.
Yeah, I'm just venting a little bit. As far as the Jewish religion goes and the temples, Jewish peoples have had so many doors slammed in their face.
Yeah.
Like at churches, you can attend church anytime you want for any holiday. There's no fee. At the holy holidays, they just let the people that can afford to pay high prices for tickets to attend the church, and I think that's a big sin right there. And also to become a member of its church is very unaffordable for people who cannot work or are unable to work or are on benefits. And lots of times if people might want to join an event or committee, everything costs money there. They need to change that, and the rabbis or ministers need to give sermons about love and expectance of people recovering from mental illness.
And I think what you're saying is probably important because it's telling us what you have been, experiencing, and then we as a faith community, we have to pay attention. And I think that's the emphasis of these conferences, and almost in every session that we have, is that we have to listen, and then probably the pastors could be priests, pastors, or whatever clergy.
Right.
We have to be, able to listen to the concerns. Okay,
Right.
so that's very important.
Thank you.
Yes.
Well, I belong to the Society of St. Vincent de Paul,
Okay.
and as a Catholic lay organization, we have groups in different parishes, and I am a spiritual advisor for the group in my parish, and I think this is, this education is great because it's, for example, like me, that I serve the needs of the people in my community. I can understand what she's saying because we have a lot of people that have mental issues or illnesses that come and seek assistance from our pantry, for example.
Right.
And I think that if we're not educated enough to understand, then we have the same reaction as you said. Don't sit next to me.
Right.
But it doesn't matter what is your faith. We all are children of God, however you want to name him.
Yes.
And I think it's basically about education, and I think it's our job to educate the people in our community of faith and explain to them, that this is a reality.
Right.
And we must, for example, I approached my pastor and I explained this to him, and he's kind of giving me like a weird look, like, where are you coming from? And I explained to him the reality, and now he's seeing things in a different aspect. And I think it all comes down to educating ourselves so that we can understand the issues that are happening out there, so that we can, we can be able to understand. So
And-
it's basically
Yeah, and the approach of this seminar was basically education,
exactly.
and not only education, providing, where the resources are. And I think that's the value. So let me go quick. These were the goals of the seminar. Help pastors and lay persons to understand the church's responsibility
Mhm.
in ministry to people with mental illness with love and discernment.
Right.
So that was the one of the goals. Okay.
Right.
So, and the other one is learn about the different types of mental illnesses and what their treatments are,
Mhm.
the role of spirituality in the recovery process,
Mhm.
and what resources are available within Los Angeles County Department of Mental Health. So those were the goals of this seminar, and those are very important because, in a sense, there were things that we were talking right now, about.
Mhm.
So what I was presenting before was the basic, the foundation of this seminar. The target were clergy or church leaders and volunteers, and we have there 38 individuals associated with faith-based organization, and additional 19 individuals. But what was interesting in this seminar is that even though it was geared to Latinos, pastors, we had some African Americans, we have also Caucasians, so it was from different, not only faith backgrounds, but it was culturally diverse, which I believe that was good. And it was interesting that even though they provided some Latino statistics, the people there identified with the Latino population, because in a sense was something that they identified. So pastors, deacons, they also were part of that. Okay. This seminar had three very distinct presentations. One about the Latino health, and the other one about the role of spirituality in mental health. And it was very interesting to see a PhD, a psychologist, talking about spirituality to pastors. Okay, so that's a good thing. And then, as I was mentioning before in the background, that was important. So we were trying to see if we were able to talk in the same language. Okay, so he was presenting that, and then also he presented general, because depression is for Latinos, depression is for African Americans, depression is for Caucasian, depression is for Oriental, and it's for everybody.
Right.
We are human and we suffer that. And then by him presenting those, what is the role of spirituality, and explaining us about the different brain disorders, he helped us to understand that. Help us to understand that a brain disorder is an illness. Okay, it's not only something that is in your mind. It's an illness, and you may need medication, you may need resources. And the third important thing that was very important is the services that were provided for the Department of Mental Health. So it wasn't only the a theory that the practice, but it was also where you could find the resources where you could refer your the members of your congregation. So in that sense, it was very meaningful education, and then if you find somebody, probably those things, and then go and find the resources. Yes.
When will this take effect?
This one took effect in White Memorial. It was like about in January of this year.
Where?
So-
Water Mary?
White Memorial.
Oh, Water Mary.
So my question is, we talked to all the pastors about that people have mental illness. When you guys talk to the pastors about that people have mental illness, about when they can't just turn them, that they can't shut the door on them.
Yes.
So when will it take effect with that?
Well, we hope that those pastors who attended that, they will put that into effect. And then I'm going to share with you something there that probably is important about the evaluation, okay?
Okay.
Because in every, it's good in every program, seminar that we do, it's not only we provide the program, but it has to be some kind of evaluation. Okay?
Yeah.
So this is evaluation that probably is meaningful, at least for us. They have a pre-survey questionnaire, and they 27 participants completed and returned the survey. And then overall, the participants, the pastors, were interested and involved in various ways to support persons with mental illness in their faith-based organization. So somehow they were involved. That's according to those pastors who were there. Yes.
Your pre and post test, was it designed specifically for this particular training, or was it a pre and post test that were
It was
related
for this specific training.
for this specific training?
Yeah. Okay. But probably could be applied, for adapted to another.
Is it possible to get a copy of that?
We could talk to Adrian to see what we could do. Yeah. And I think what we could do, and this is, as I forgot to mention, the evaluation was conducted by, by Dr. Yamara, who is associate professor, the School of Social Work. So they put those things together. So that was, that's important thing. It's not like we sat down as a pastor. So it's like, it's legitimate. Sometimes we count here and there, and then with those things, so it's legitimate. So those results is that put more validity to the things. Okay. Yes.
Yes, we have a very successful service extenders program where consumers are trained from DMH to work with the older adult population. We've also had successful peer supporter trainings that I would like to see start in the clergy community to be trained to work at various congregations. Peer
Okay.
supporters trained in that area. I think I'm going to mention that in the next
Okay, yeah,
meeting.
thank you.
Yeah.
Okay, so going back to this evaluation, so overall the participants were interested and involved in various ways to support persons with mental illness in the faith-based organization. 90% of the participants reported that they will seek opportunities to support people with mental illness. So that's important. 90%, they say that they will gonna try to seek opportunities to support people, and 56% reported that they have provided pastoral counseling in person in the congregation living with mental illness.
Yep.
So that was the questionnaire. So 56% of those who were there, they say that they have provided spiritual support. They say that there was a preparation to collaborate with mental health to increase, that increased from morning to afternoon. So after the intervention was done, after the seminar, so we see a difference there. A greater percentage of clergy felt somewhat or definitively prepared in the afternoon compared to those responding likewise in the morning. So in the afternoon, when the same question as the post-survey, so 78% felt that the training had a positive influence upon them, and then they were more prepared to provide mental health. Okay? And then also the motivation to minister with people with mental illness changed from morning to afternoon. In the morning, 11% of the clergy reported little or no motivation. So at the beginning, this is the survey, so it was no motivation, 11%, which is, it's not that bad. But in the afternoon, 100% reported being someone moderate or very motivated to minister to persons with mental health. So we see that there is the intervention produce a positive effect.
I'm just saying 5
Yeah,
minutes.
okay. And then for the open respondents, if you were to intentionally seek more opportunities to support people, so those were some of the things that they say. We would like to have some hotlines, translations, community resources, educational materials. So that's important. And I need to talk about what they can do in their churches. And then I think that is important that we need time. We need to talk with our congregation. There has to be a communication between the mental health and the pastors. Presentation was very meaningful. Provide bilingual translations of slides and handouts, and that was another thing because presentation was done in English, and it was translated, so probably one of the things that they suggested, and that's something that should be taken into consideration, that the material should be done, in their language. And provide opportunities for pastors to discuss and other things. Okay. I think what is important with this study, with this seminar, is the fact that there was education. It worked because at the end of the service, the pastor was motivated. It was as a means for us to understand a little bit more about mental health. And mental health department understand the pastoral or the religious, the faith-based.
How long is it?
We have it the whole day.
So 8 hours?
8 hours. So like about 7 hours. So, ¿usted atendió ahora?
Sí, está bien.
Yeah, she was there. So it was, and then I think in the booklet there is a sample of the agenda. Okay. And what is important, I think, if you would like to have one of these in your congregation, or put some of those speakers, probably you could contact the Department of Mental Health and then see if you could arrange and then things like that.
Did you give the pastors an opportunity to talk about, or did they feel it's safe enough to talk about their own experience with mental illness in the context of the meeting?
At the end, we have some time, but probably what happened, that's something that, that's something probably we could put it more in the morning. Because in the afternoon, we were almost closing, and then even though we talked, but we didn't talk that lengthy and then that much, and then probably people were in a hurry at the end, so we were wanting to go home. But we had the opportunity that's probably something that we could, expand. Yes. Okay.
Excellent.
Okay. Yes.
Yeah,
Sure, because I'm taking questions.
No, questions important.
Yeah.
Questions here you mentioned about collaboration,
Yes.
how important it is with the mental health providers and the community, as well with the consumers.
Yes.
But consideration for consumers who are working, like me, we're looking for something like after work meetings, because otherwise we cannot attend to because we're working, and we really need to be aware of that thing that spirituality is really very helpful for us.
Yeah, and then the idea, we hope, at least that was the intention, that, they were trying to train the pastors, and the idea is that the pastors then will go to the churches and then train or be understanding for the leaders of the churches. Okay? So it's kind of not only you, but we're going to empower. So when you go to church as a pastor, you could get the elders of the, the church, or the leaders of the church, deacons, or whatever, and then try to educate them on mental health. Okay? I've been hearing, from the customers a lot, so that's something that probably we need to, provide them. Okay.
Very important.
Any more questions?
Any more questions?
No?
No.
Thank
Thank
you.
you.
Thank you, Pastor. Thank you so much.
The questions are really important. That's partly why we're gathered together, is to be able to have an exchange and to talk to each other. And, I think some of the themes of the common ideas that you've brought up today is, I just want you to know that this is the 11th year of having a mental health and spirituality conference. And this is really the essence of the work we want to do, which is to advocate within the mental health community and within the clergy community better ways of working together, and to really use this experience that we're having together as a way of building against the stigma of mental illness, especially in the religious and faith community, like you're mentioning, so that when you go into church, or you go into a synagogue, or you go into a mosque, or you go to a Buddhist ceremony, that you are feeling that you belong there, that you're welcome there, and that people are embracing you with exactly the things that you're saying, with the love, and that you promote within your congregants a feeling of forgiveness and the feeling of value that they have, of the meaning. So this is really a lot of our mission together for these conferences that's the 11th year, is because we know that over these 11 years we're having a deeper and deeper impact. It's spreading farther and farther, and all the different workshops and things that we have, they create ripple effects out into our community. So thank you again, Pastor Urbina, for a very beautiful excellent presentation. To continue our conversation by talking about and building on what Pastor Urbina was talking about, creating these activities which bring clergy and mental health together. Here we're going to hear about an example that's been going on for 25 or 30 years that is actually a center for counseling that is set right in the middle of a religious organization. And in a sense, it's really a model for what can happen across our communities in all the different religious organizations in Los Angeles, of an idea of how to do this. And in fact, from our clergy advisory committee that meets every month, they were inspired at the Crenshaw Christian Center, which is in South Los Angeles, to create a counseling center after they heard about various different things that were going on in Valley Beth Shalom and Latino. And I'm very, very pleased and thank, of course, Pastor Urbina and Judy Cotton for taking the time to be with us today to show us these examples. And Judy is a licensed therapist for over 30 years. She is a therapist in relationships, with workshops. She specializes in really birth to death. Individuals, couples, families, adolescents, children, and I'm sure the elderly. She's a certified parenting skills educator, lecturing and teaching in Los Angeles, and she works especially involved in the motion picture and television wellness program over the last 14 years. She is positive and practical, providing every client with support and encouragement directed at their growth and individuality. She believes that relationships, being connected to others and living well, is an essential part of being a human being, and that everyone has a right to full respect. She strives to help couples, families, and people develop skills to enjoy happier and more satisfying relationships. She is a champion for children, and she works hard to ensure that their voices are heard and their needs are recognized. She believes in encouragement, consequential learning, and positive discipline, and works towards celebrating the individual talents and unique qualities of each client at any age. So I'm very happy to introduce Judy with all her wonderful experiences and to tell us more about the Counseling Center.
Yay! We are the brainstorm or inspiration of Rabbi Harold Schulweis, who is now 86 years old, and our rabbi. He has been our rabbi since 1968, I think. So shortly after he came to Valley Beth Shalom, he realized that up in his office, congregants would come with all kinds of problems, family problems, individual problems, whatever, that he did not feel he had enough experience, brilliant as he really is, to deal with on a long-term basis or to provide. And so he had this idea that we could, on our grounds, train what he called paraprofessionals among our congregants and create a place that would be a fully functional mental health center for not just congregants but open to the entire community. So it started with, he called a meeting at one of the psychiatrists' homes, and he contacted all the psychiatrists and all the psychologists that he knew in the congregation to come to this meeting, and he gave them his idea. And they all looked at him like he had grown another head. Because as you know, you can imagine, this is 40-some years ago, that the spirituality and mental health and these scientific psychiatrists and whatever based in that thing looked at him and said, what are you, crazy? However, and then seriously, they did. But two psychiatrists in the group took him seriously. And they molded over in their heads, and maybe, and this is the true story, about 2 weeks later, one of them, a very prominent pediatric psychiatrist in Encino, called him and said, I'd like to talk to you about that. Okay? His name, may rest in peace, was Dr. Arthur Sorosky. And Dr. Sorosky and Rabbi Schulweis talked, and you need to know this about our Rabbi Schulweis, God bless him. He always has brilliant ideas, and his administration skills are zero. I'm serious. He is the inspiration, if you've ever heard of it, of Jewish World Watch. You know, you've heard of Jewish World Watch, where they're doing against genocide in Darfur, and the program with the solar cookers and all of this kind of thing. He had the idea, but he had to have lay people come in and do all the administrating. This is the same sort of thing that he did with our counseling center. Anyhow, Dr. Sorosky took the ball and ran with it. He spent a year putting together a curriculum. He spent that same time figuring out who he would look for as candidates to be the counselors. And he also contacted many, many people to be teachers and professors to teach these people. He put together a program that was going to be for our volunteers. It was going to be a 2-year training program with, and I don't remember whether it was a 164 volume reading list or a 64 volume reading list, but either way it's rather daunting. So that was it. So and then we were to meet about 6 hours a week in 2 different sessions to be trained to become mental health professionals. It was like a master's program. In addition to that, we had to write or be interviewed and be accepted. At a high holiday service, 2 years after this started, Rabbi Schulweis gave a sermon and launched the program. And there were about 118 people who volunteered to try and come into the program. From that 118, they chose 18 candidates. That was the first year. And they trained them, and they opened the doors after 2 years so that we had counselors. I was in what was called the third class, because 2 years after the first class, we had business, and they trained another class, and then I was in the third class. Same thing happened with the third class. There were over 100 volunteers, and of that 100 volunteers, they selected only 18 of us. I have a colleague, Harvey Keenan here, who is one of the people that was in training with me. Many of us went on to become marriage and family therapists, LCSWs, or actually credentialed and licensed professionals. That's my case. But we did this 2-year training program, and we had the most incredible teachers. All of the teachers volunteered, and all of us were volunteers. The reason we could do all of that is because space was made available for us at the synagogue, which is really tight on space and has a real problem. But we actually have 4 rooms, small rooms where you counsel. We have an office. We have a group meeting room that holds about 25 people. We have a small group or family room that holds about 14 people. And it looks like a counseling center that would be anywhere else in the world. We had lawyers step up to the plate to write our bylaws for us. We had accountants and tax professionals step up to get our 501c3 certification so that we're separate from the board of directors or from the synagogue itself. Because one of the things our board was very concerned about is that if we had a malpractice suit against us, that the whole synagogue would come down. And of course, that we didn't want to have happen. So we went through all those formalities, and all of that, and I'm stressing this, all of that was done at zero cost to anyone, because we had volunteers who did that. Some of them were, of course, husbands of the volunteers who were being counselors. They were attorneys, but that's okay. But that's how that worked. So we have all of those things, and I personally have shared them with many, many congregations and many churches. The people from the Crenshaw Church that started their pastoral counseling services and their mental health thing came and spent a full afternoon with me about 2 years ago, maybe 3 years ago, and I gave them all of our materials. I have no problem with, we can't give you any confidential information, but we can give you our intake forms, all that. Anybody who wants it, I will make it all available to everybody. Okay, so who do we help? We help anyone who comes through the community, who's referred to us. We have an answering service. We pay for that ourselves from the funds that we raise from clients. Clients do pay, but clients pay on a very minimal sliding scale. I have clients personally that pay $2 a session. I have clients who pay $50 a session. I don't get the money, so it's not a reflection on me. In my private practice, that's a different story. But in the counseling center, we don't do that. Often when I see 20-year-olds or people that are just starting in the workforce, I say to them, what are you making an hour? And if they're making $12 an hour, then I'm taking $12 an hour. My hour's worth their hour. And that's very, that's respectful to them. Yes. Thank you for joining us. We're not doing it as a money-making thing, but we do have to cover our expenses, and that's it. Any excess money we use, we give to the synagogue to promote other programs or our own programs. We also have a very strict policy about our education program. We help pay for continuing education for all of our counselors so that we're up to date with whatever needs to be done. And we, of course, maintain our own malpractice for the counseling center. But we're not a government agency, so we don't have to do all of that reporting in 14 million papers of everything. But we have very strict standards. I brought a copy of our policies that I can read to you if anybody is terribly interested. Okay, we do not take walk-ins. That, I shouldn't say never, because on rare occasions, like when we had the earthquake and we have certain disasters and things like that, we advertise and we say that someone will be there from 9 to 5. We take evening appointments. When you call and you get an appointment with a counselor at the VBS Counseling Center, that is your counselor, providing after the first intake it's a good match. If it isn't a good match, then you might meet with another counselor. But we do individuals, we do couples, we do families, and we run certain groups. I have a group for the newly divorced and separating. We have a women's group, and we have a group for the never married, I think it's called. And we have a new group starting for grief and bereavement. They all meet in the counseling center. Are there any questions about that part? Who we serve?
Premarital?
We do. Actually, I'll give you the brochure. We wrote a course on premarital counseling specifically in order to try preventing divorces is our real theory. That's our motivation. And I brought one of them. I brought one of those. We only had a couple of those brochures. We have to reprint them. But it's a 5-session course. And you meet with one counselor, and each session has specific things that we believe need to be brought up. And of course it goes with the people too, but all about family backgrounds and things that people don't discuss. And I have done it with couples many, many times, and my favorite thing is to see them, I run into them in an elevator somewhere or at Walmart or somewhere else, and they've got little kids in a stroller, and I just love it. It's really great.
Judy,
Yes.
do you have to be a member of the
No.
congregation?
No, you do not have to be a member of our congregation. All you have to do is call and be screened, and we decide whether you can be a client. The only thing is you must be a member of our congregation to be one of our volunteers. That's
And any religious group?
no. We have
Yes,
people.
any religious.
Any religious group can come in for counseling. We have people from the Armenian community. We have people from the Catholic community. I think one of the things that Pastor Urbina talked about was this blending kind of thing. And one of the things, and I wanted to say it this morning, but I didn't get to say it, is very often people are more comfortable coming to some place where they know there is some religious connection, because that's who they are. And they feel like it'll be more generous, more open, more giving, more loving, more all of that sort of thing. So the faith-based idea has worked for us very, very well. And we get many. It's interesting. We're a conservative congregation, and if you know anything about Judaism, the very, very Orthodox are not so thrilled with us. But we get clients from the very Orthodox community because they know that we're going to at least support that sort of thing. Yes?
I hear you saying that, or I was reading here that it says you take your clients by referrals. I mean, for example, I am part of the Society of St. Vincent de Paul.
Yes.
Or can we refer people?
Absolutely.
Or just, do you have a specific line of, for example, Beyond Shelter? They will not take clients unless they are referred to them by an agency that is.
No, we have no restrictions on that. What we have to do what we call an intake. In other words, a client will call the main number here, which is right in the front, the 7841414 number, and goes to one of our counselors. We take it alphabetically, week by week. Each one of us takes a week on the phone. We call back the client. We do an intake, we have an intake form, we'll ask all kinds of questions and things like that. And then, depending, we will, on availability and all of that, we'll match them to one of the therapists. They will call them and set an appointment, and it's what we call the intake appointment. After the intake appointment, if it's a good match, they'll set up their ongoing thing. We have clients that we see for years and years and years, because it's supportive therapy, and that's what they need. We have other ones that we see for 6 months and they're on. We have others that we refer to the outside community because we're not able to handle them. We make those determinations on a case-by-case basis, but we're not forced not to see a group, and we're not forced to see a group. Okay, so it doesn't matter. We're listed in 211, and we get referrals from, as I said, other clients, obviously, from rabbis, from churches, from all. We do often ask how you got to us, but that's not the most important thing at all. Yes?
Yeah, for people that want to keep their mental health maintenance, what kind of volunteer programs do you have at the temple other than the counseling that people that area that lived in Encino went to the temple could participate?
We have several programs. We have a program that this is not part of our mental health program, but we have a sisterhood. We have men's groups, a men's club. We have a group for over 55 called Hazak. I didn't bring men.
You have to be a paid member to do all those
No,
things.
Hazak is I believe $18 a year. Is their thing, but I imagine they have scholarships too. One of the things about my particular synagogue is that we made up our mind, especially maybe 4 years ago when the reversals in the financial community became evident, that we would lose no members. So we have sacrificed a great deal, and others who can afford it pay, but we don't turn people away if we can possibly help it, as long as they really want to be part of our community. That's an unusual, I know that's different, and we do have to pay to keep the lights on, and we have to pay our rabbis, and we have a big staff. So it's a burden, but the financial responsibility of our congregation, and right now we are in the red, but hopefully it'll change someday. That's how VBS works. I cannot speak for other congregations. I can only speak for Valley Bishop. And we have a big program called the Chesed Connection, which goes out and does volunteer. We have our own food bank at VBS, for example. It's really good. You want me to get back on my stuff?
No, I just wanted to add to, I think that's a very good point that you're bringing up with the question that you were asking about, if a religious organization has a mental health center within it, and then what kinds of link might they then make to some of the programs within that religious organization.
Which is one of the things we do.
And the thing that's so important about that question is because one of the things we talk about in our work in the mental health department is how important the social connections are, that now they know for all of us, much of our mental health is so based on the social and active social relationships that we keep in, keeping social relationships active. And so
when we save a lot of money.
So this is very important, because this is another source why the connection between mental health and faith outreach is so important in our department is because we know that the kinds of programs that churches, synagogues, and mosques offer are not just the possibility of, we'd like to promote more mental health services within those congregations, but also that all those social aspects of being involved is so important. And certainly, I know that you know, that's another way in which your particular synagogue is the leader.
At our, at all, I imagine all synagogues, Friday night services are free, and Saturday morning services are free. And in addition to that, at VBS, it's not running in the summer, but we run a Wednesday night lecture series on various topics that's open to the public. We get 300 to 400 people there. Then we have the Kazakh program, which is every other week for people 55 and older, that has a whole program that lectures and they study opera, and they have tax analysis, they have all kinds of, they have a very varied program. And then we also have something else that's very interesting. It's called Lunch and Learn, and that meets, I think, twice a month, where our rabbi, our senior rabbi, people bring a dairy lunch, and he lectures, and they get 60 to 70 people. And he has, I don't know what he's doing because I haven't been there, but he does something through the thing.
Judy, I'd
Yes.
like to say something.
And Harvey is, as I said, one of our, now he's a total paraprofessional. He went through the 2 years training. He's a
total
businessman.
paraprofessional.
What I'm saying, he's not one of the licensed people, but we don't make, if you noticed on here, if you list it, we don't list the credentials, because we've trained our volunteers at such a high level that we're all equal. And the way we work to keep us our integrity and our high level of professionalism is we meet every Monday afternoon as a group for a presentation, and if you're having trouble with a case or you want, and new cases are always presented, because that way you get the feedback. And as a professional myself, I wouldn't go to a therapist that didn't have that kind of a support group, because then you get that demigod kind of thing going, and you don't want that. That's really bad. Yes, Art.
Okay, what I wanted to just, I wanted to make a point. Being a paraprofessional, I was in the same class with Judy, and I studied for 2 years, so I was very well trained. And then I incorporated my own life experiences into my counseling. I currently have 7 clients, which means about 10 hours a week, including the hour and a half Judy spoke about, where I present my cases and I'm given advice. And by our residing, we have a psychiatrist who volunteers his time, who can also offer medication. And people like Judy, who have a lot more experience than I have. But I just want to say, as a lay person, this is very important for me to get through to you people and into your churches and your mosques and your synagogues. As a lay person, I was inspired. And there's 2 sayings in Hebrew that I'd like to share with you. One is called Tikkun Olam. And Tikkun Olam in Hebrew means to repair the world. And that saying really inspired me. Not that I alone can repair the world, but if I could contribute something, it just enables me to be a better dad, a grandpa, a business person in the world. And then on top of that, the counseling, through the counseling center, I found another phrase that I connected with. And I say this because I'm only a lay person. And the other phrase that I connected with was a phrase called Tikkun Atzmi, which means to repair the soul. And when I'm counseling, not only am I counseling my clients, I really feel I'm learning and becoming a better person myself. And I'm repairing my own soul. So to the people that are leading the churches and the mosques and the synagogues, I say to them, if you can get the lay people involved and train them, it's a tremendous asset. It motivated me, and I'm sure you can motivate all your people, a lot of your people in your congregations. So I just wanted to share that as a lay person. And Judy Cotton is one of my mentors, so I wanted to say that.
Okay. How much time did I got?
Well, about 5 more minutes so that we can talk.
Oh, okay.
More
All right.
questions.
as I said, the funds are not the big deal, but we work that out as best we can with every client. And we, as Harvey said, we happen to have on staff a retired psychiatrist who is there and can write scripts if we need that, and do mental status examinations and do that. He will only see clients that we refer to him. He's no longer in practice, but his credentials are rather enormous because he was head of psychiatry for all of Kaiser, in the southern part of Southern California. So it's not like he's somebody we just found on the street. And he taught at UCLA and at Cedars, so they're very qualified people. And that's about it. And you can do it. Your pastors can do this if they want to. I know it's a different structure at synagogues than it is at churches, where you have many they're not lay people, they're actually ordained, they're ministries and things like that. It's a different kind of structure. But getting the mental health training as a group, I think, would be very, very important. Yes?
I know you said that our churches can do this, but one of the things that's unique to your situation is that you had people in the congregation who were already practicing providers. And so you had a psychiatrist that was in the...
One psychiatrist in the congregation of 1,700 families.
But you said something about pulling together all the social workers and counselors who were already
He had a group of, he called on them. But, and I went through this when the people came from the Red Star Church, and one of the things when they said to me, who did the legal stuff, and how did you get that done? And I cannot believe, I don't know how many people are in your congregation, but it's very hard to believe that if you get them educated to understand the meaning and the importance of that they couldn't, a lawyer, an accountant, or somebody can't give a Saturday afternoon, a couple of Saturday afternoons to sit with you and get the paperwork done. It's a little bit like Dr. McKenna said, who was it that was talking about the grant thing, and it was not written in Adrian. It's not written in our language. I get that. It wasn't written in my language. But no.
That's easy to do. I'm thinking more about the mental health training,
Right.
and the supervision when you don't have on staff or in the congregation licensed mental health providers
But,
to do it, to create
I hear what
a
you're
counseling
saying.
center.
I would challenge that you don't have them. I would challenge that you have them and that they are there and they don't even make that transition. They're over here in their professional life and they're doing it. And part of the reason ours worked was because we took really non-professionals and decided to train them by professionals. And then of this list on here, which, as I said, doesn't have any of our credentials, except mine, but of that group, half of them are already credentialed. We have a couple that are actually in training right now that will get their licenses. But the point is, when we meet at our group thing, we accord them all the same kind of prestige, if you will, whatever you're saying, and it elevates them. And my guess is you could get a program, but you have to have people who are interested. Dr. Sorosky, for example, did not teach every Sunday morning or every Wednesday evening at the course. He had people that he knew. How he did it, I don't know. Twisted their arms up, upside down and backwards. I don't know what he did, how he did it, but we're lucky to have that. The other thing is we're about to launch a new model, not a new model, but a new training program. I will let you know how it goes, but we started by asking, we're looking at names of, the rabbis have a list of people who are interested, people call us. We just celebrated our 40th anniversary at the counseling center, so we had this big evening and people talked about it. And I have right now on my desk a resume from a MD who is also an MFT who teaches at UCLA, part of their teaching staff, who would like to be a volunteer at our counseling center, who is a member of our congregation. She's about 50 years old, and I can't wait to get her interested to do this kind of thing. And I'm sure there are others, because they call us all the time and want to volunteer. So I
wanna
think
say
it's
one thing.
asking, yes.
Are you saying that it's difficult within your congregation to come up with legal expertise and the accounting expertise?
No,
Is
no,
that what
not,
you're saying?
no, the legal expertise is not the issue. It's having licensed clinical professionals in the congregation who are available to volunteer time.
We had that
become
problem.
trainers.
When we first started 40 years ago, we really were challenged by those we're on Ventura Boulevard, and if you know anything about that corridor, we're in Encino, there must be 2,000 therapists right there, I mean, in 5 miles, okay? And one of the things many said was, you'll be taking clients from us, and you're gonna do it nonprofit, so you're not gonna charge very much. How are we gonna continue making a living? You're doing that. But it turned out not to be the case. It turned out, in fact, in our first years, each one of us was assigned, in pairs, 2 of us were assigned a supervisor in the private community that we met with once a week when we started seeing clients. This group thing was an innovation that I started when I became president, because I realized the expertise was, we didn't need to go outside, we had enough expertise in our own group. But when we started, all of us unlicensed, we needed to go to these professionals. For whatever reason, professionals, some of them not members of our congregation, some of them just believing that they wanted to help other people, saw us in pairs. I went to Kaiser Hospital and saw a PhD psychiatrist there every week with my partner for a year and presented my cases. We were able to get them. I think it's a mentality, and I think that they had to recognize we weren't threatening them. And the other part is, we didn't see clients who had insurance. We don't take any insurance. So we didn't threaten that group of people. And I don't know how that would work. I think it's worth a try.
Well, I think the other thing that you might be surprised, because many times, I do want to go on, but I just want to say one last thing. In many times we talk to pastors who say within their own congregation, they don't even know exactly who is coming every Sunday to church, what particular professions they are. If they were to do a survey of the congregation, they may find that they actually have people who could participate in creating this type of thing. But besides that, I want to urge you also to think about the mental health department and the clinic that might be serving the particular area that your church is in the same way that we're now working with the St. Vincent de Paul Society, and we're actually going to create workshops for various different, because they are a full volunteer, international volunteer organization, and we're actually going to be working with them to create mental health workshops in which we bring our experts and can train them to do the kind of
there
peer
may be people
counseling
that
the St. Vincent de Paul can then offer as part of the services of a wonderful work that they do.
What about
So
the
you're calling it
student
para-counseling?
Student?
Well, when
we-
you're trained without a, you can do
Yeah,
it.
well, the difference, the hierarchy, according to the California licensing thing, is that if you're a paraprofessional, you cannot use the word therapist,
Right.
but you can use the word counselor. So they're paraprofessional counselors.
Okay.
And the qualifications to become that would be set by who's ever allowing them to counsel. We had high standards for ours, and I would, suggest pretty high standards for yours. But for example, you can get a credential as a alcohol or drug, a chemical dependency counselor. It's called a KDAC. Okay, but that's different than what my license is, which is the MFT. So we have all of these different variations, if you will. But getting lay people to volunteer, or maybe even young people. I'll tell you this, I don't know where you're located. Where are you located?
Sacramento.
Oh dear. We started one in Sacramento, actually, at Mosaic Law, I think it's called, this congregation up there, Rabbi Taft. And he put me on his advisory, and I sent him all my materials, and he's one of ours that we
Someone's been
started.
waiting patiently.
Yes, go.
That's okay. I'm seldom patient too, so it's great.
Oh, must be my calming.
It's fabulous. First of all, thank you.
You're welcome.
I'm a social worker. I have a background in community capacity building, so I'm the mind
Right,
of the
you're
community
both.
for assets all the time.
Right.
Also serve a small congregation as a Lutheran pastor in the valley.
Okay.
So I'm
In
thinking
the
in terms
valley?
of in the valley.
Okay,
You know,
I volunteer to come and teach for you.
Well, this is one of the things I'm thinking because we're a Lutheran congregation and we're connected to Lutheran social services.
Right.
There are possibilities for coalition building with congregations so that it's not just your congregation where you feel you don't have the assets perhaps, even though you probably do. And the question I have is, how willing are you, or do you, broaden your educational opportunities for others to be included? So would you be willing to train people from my congregation in your program to do this?
I can't see why not.
I mean, I don't know personally yet, but
I can't see why not. If they're willing to come, absolutely. We're very non-parochial in that sense. And we're very, we're very inclusive and not exclusionary. At least that's who I am. And that, since I'm the president, I can speak for everybody. No, I really can't imagine that would be a problem.
it just seems like such a great idea. I mean, to replicate.
Exactly, because as a social worker, you've heard of Dr. Piaget, Piaget theory. Oh, 30 years ago, when I was being trained, 32 years ago, we had a disciple of actual Dr. Piaget who came over from Europe. He was here to do some series of classes for UCLA, and for some reason, and this is what is the sort of miracles that happened, Dr. Swarovski was able to get him to come, and for 3 hours he taught us Piaget theory, sitting on the floor in our from his name is Dr. Tangeray. It was amazing. I mean, that's the quality of lessons that we were fortunate to get. Can I duplicate that? No. Maybe yes, maybe no. But you have to mine the resources to find out. You know, I didn't know about this program. It's a wonderful, wonderful program. And the statistics, I loved what all of that. I'm really gonna.
I think we're all a bit too humble sometimes about the resources that are available to us.
You don't know, and I think that Karen's right. You've got to sort of go out there and ask. And you need a great speaker to do it from the pulpit and say, this is the program. And that was really and truly, without Rabbi Schulweis launching it and supporting it all this time, we wouldn't have it. But then we wouldn't have our food bank, and we wouldn't have the Jewish World Watch, and we wouldn't have our Custard Connection. They built homes for Habitat for Humanity, clean the bay. We've sent delegations to New Orleans to repair after the flood and everything. We've sent a team every year to build houses and things like that. I mean, that's the kind of congregation we're running, but that's because who we're running it
Without a
with.
vision.
But that's the interesting
Exactly.
thing about the pastor, because that's why we're working on the pastors, that's why we're
Yeah.
working.
You need the
we want to create a
charismatic
really
leader.
Close partnership with clergy, because we hope that, we can't tell the clergy, this is what we want you to put in your sermon, but we're hoping that somehow we get into the clergy's sermon, because that's where it has to come from the clergy. And then the congregation will, then a lot of things can start happening.
Can you possibly use like student interns to provide some counseling centers where they've used, interns?
We don't use them.
Oh, you don't use them, okay.
It's different models, there's different models.
Okay, I was just
It's
asking.
not a bad, good or a bad, or
Yeah.
right or wrong.
Okay.
But I think someone next to you had a.
Yeah, I'm just wondering with your group right now, do you have consumer that's doing counseling?
No, we don't have any consumers doing
Would you
it.
consider that?
I doubt very much if we would. First of all, the first thing is they need to be members of our congregation. So they,
All member of the
yeah,
congregation.
that's one of our, that's been our tradition all along, so.
That's the model that I'm promoting though. I think that there's a movement in mental health. I'm the deputy director for the California Institute for Mental Health.
Okay.
I'm also the senior pastor for a church in Sacramento.
Okay.
And so, I am, Urbina.
Urbina.
Yes, and so across the state, peer certification, peer support specialists, peers are becoming integrated into almost every level of care, even in the healthcare reform movement. Peer services are being offered as part of the process, and I think that it's a beautiful opportunity to get people who are living with mental illness the opportunity and have achieved and are working on or have achieved a certain level of recovery to get them to help mentor other people in the congregation who are also, having challenges and managing their lives. There's projects like, there's curriculums like mental health first aid, WRAP, the Wellness Recovery Action Plans, that are geared to help peers or help people living with mental illness actually sort of manage their own outcomes and plan for future, concerns and issues. It's also a strategy for helping people connect with services that are available in the community that they normally wouldn't have access to. And so,
They currently do that with drug addiction.
Yes.
With people who are formerly drug addicts, mentor people who are going through that right now. That's
I
ongoing all the time.
think there's things from this model that can, pieces of it can be taken and applied, and then different people can create different models.
These counseling centers, mental health counseling centers are hiring peers to serve as case management support and outreach promotoras, help navigators, people who can go
The big
beyond
thing is that,
center.
see, because we don't have any big hierarchy in our program, we all take on our individual clients and bring questions and concerns like that when we follow the certain intake procedures and stuff like that. But other than that, it's an individual quality of care, and because we also meet and sort of supervise each other, it's pretty high, I believe.
I see we've run out of time, but you know what? We can continue this conversation because we're all hungry, I know, and it's time for lunch. So please do that, continue these conversations because it's been very stimulating, and thanks so much.
Thank you very much.
Thank you, Pastor.